Hi, Mr. Smith. My name's Kyle. I'm going to be your nurse today. What we're going to do today is perform a PICC line dressing change. It's a sterile technique in order to minimize any bacterial exposure. First thing I want to know is your name and birthday. I'm going to check Mr. Smith's name tag while he repeats that information to me. I also want to know if he's allergic to anything. Mr. Smith's not allergic to anything, so we're ready to proceed. Mr. Smith, this is going to take probably about 5 minutes. There's no real pain or discomfort involved in it. And as I'm going along, I'll just kind of explain what I'm doing. And if you have any questions for me, just stop me and let me know. So I'm going to gather my materials. I have a pair of sterile gloves here. I have my sterile kit, which includes everything for my sterile field. I also have a mask, an extra mask, in case Mr. Smith would like to wear that while we're doing it, or he has the option to turn his head to the side just to maintain the sterile field. So I'm going to go ahead and get started. I'm going to wash my hands. I'm going to get a pair of clean gloves in order to perform the first step, and that's to remove the old dressing. I'm also going to. It's also worth noting that when I look at my dressing materials, that the expiration date has not passed, so our sterile kit's good to go, and there's no signs of puncture or anything like that. So, Mr. Smith, I'm going to go ahead and remove your old dressing. Best way to do this is kind of gather the edges and kind of tug outwards so that the dressing kind of comes up, because this adhesive can kind of stick to skin pretty tightly. Okay, and once that's off, I'm just going to kind of assess the PICC line, the integrity of the line. I don't see any edema, I don't see any redness, I don't see any discharge, anything like that. It seems like the PICC line is in far enough. I don't see that little line that says that's too far out, so we're good to go as far as that. I'm going to remove my contaminated gloves, and we're going to start establishing the sterile field. First thing I'm going to do is I'm going to open my sterile kit out away from me, and we want to make sure that this part does not fall back onto the sterile field, contaminating it. I'm going to apply my mask. At this time, I'm also going to give Mr. Smith a mask. It's his choice if he wants to wear it, or he can turn his head to the side like I mentioned before. Next thing I'm going to do is I'm going to apply my sterile gloves. Okay, sterile gloves are on. I'm going to go ahead and use this ChloroPrep to clean the area. And with ChloroPrep, you just want to rub back and forth because it cleans via friction. So I'm going to use one of my gloves to stabilize the PICC line, and as I rub, so. My right glove is still sterile while my left glove is now contaminated. So one, and we have 3 different ones, so we're just going to clean the line as well. One more.